Ladies and gentlemen, my name is Jeremy, 24 years old, and I was born with a neurological disorder called Spina Bifida. What is Spina Bifida, you may be asking? Well, in this video I will be telling you what it is and how it has affected me in my life. But before I can tell you how it's affected me, I have to tell you how it works. Spina bifida, or split spine in Latin, is a birth defect where there is incomplete closing of the backbone and membranes around the spinal cord. There are three main types: spina bifida occulta, meningocele, and myelomeningocele. The most common location is the lower back, but they rarely occur in the middle of the back or the neck. Occulta has no or only mild signs. Signs may include a hairy patch, dimple, dark spot, or swelling on the back of the site of the gap in the spine. Meningocele typically causes mild problems with a sac of fluid present at the gap in the spine. Myelomeningocele, also known as open spina bifida, is the most severe form, with associated problems including poor ability to walk, problems with bladder and bowel control, hydrocephalus, a tethered spinal cord, and latex allergy. And myelomeningocele is the form of spina bifida that I have, and I have all of those associated problems. Spina bifida is believed to be due to a combination of genetic and environmental factors. After having one child with the condition, a parent has After having one child with the condition, or if a parent has the condition, there is a 4% chance the next child will also be affected. Not having enough folic acid during pregnancy also plays a significant role. Other risk factors include certain anti-seizure medications, obesity, and poorly controlled diabetes. Diagnosis may occur often before or after a child is born. Before birth, if a blood test or amniocentesis finds high alpha fetoprotein, there is a high chance of spina bifida. Ultrasounds may also detect the problem. Medical imaging can confirm the diagnosis after birth. It is a type of neural tube defect, with other types including anencephaly and encephalocele. And now I will go through the three main types, starting with spina bifida occulta. Occulta is Latin for hidden. It is the mildest form of spina bifida, in which the outer part of some of the vertebrae is not completely closed. The splits in the vertebrae are so small that the spinal cord does not protrude. The skin at the site of the lesion may be normal, or it may have some hair growing from it. There may be a dimple in the skin, or a birthmark. Many people with this type of spina bifida do not even know they have it, as the condition is asymptomatic in most cases. The incidence of spina bifida occulta is approximately 10 to 20% of the population, and most people are diagnosed incidentally from spinal x-rays. A systematic review of radiographic research studies found no relationship between the spina bifida occulta and back pain. More recent studies not included in the review support the negative findings. However, other studies suggest spina bifida occulta is not always harmless. One study found that among patients with back pain, severity is worse if spina bifida occulta is present. Among females, this could be mistaken for dysmenorrhea. Incomplete posterior fusion is not a true spina bifida and is very rarely of neurological significance. Next up is the least common form, meningocele. A posterior meningocele, or meningeal cyst, is the least common form of spina bifida. In this form, the vertebrae develop normally, but the meninges are forced into the gaps between the vertebrae. As the nervous system remains undamaged, individuals with meningocele are unlikely to suffer long-term health problems, although cases of tethered cord have been reported. Causes of meningocele include teratoma and other tumors of the sacrococcyx and the prosacral space, and Currarino syndrome. A meningocele may also form through dehiscences in the base of the skull. These may be classified by their localization to occipital, frontoethmoidal, or nasal. Endonasal meningoceles lie at the roof of the nasal cavity and may be mistaken for a nasal polyp. They are treated surgically. Encephalomeningoceles are classified in the same way and also contain brain tissue. Last but not least, myelomeningocele. Myelomeningocele, also known as meningomyelocele, is a type of spina bifida that often results in the most severe complications. In individuals with myelomeningocele, the unfused portion of the spinal column allows the spinal cord to protrude through an opening. The meningeal membranes that cover the spinal cord also protrude through the opening, forming a sac enclosing the spinal elements. And as I said before, I believe, this is the type of spina bifida that I have, personally. And I have seen the scar, and, well, it's a doozy. With that said, we will now go to the symptoms and the side effects. One of the main symptoms of spina bifida is leg weakness and paralysis. And as some of you may well know, I suffer from paralysis, and as a result, if I can just get this down here, I use a wheelchair. I've been using a wheelchair pretty much all my life. Hold on, there I am. Since I was about, 4 years old, possibly. I've had to replace them every few years, as I grow. The first one was a quickie, and it was blue, and we ended up selling it because I was, obviously too big for it. Then I went to a red quickie. That was probably my favorite chair, because it had a gel pad seat in it. One of those things that you sit on, and there's gel inside the pad. You sit on there, you get a nice feeling on your pressure points. It prevents bed sores and the like. And now I sit on an air cushion because of, as I mentioned just now, bed sores. Which leads me to my next symptom, which is bladder and bowel problems. Now, I have experienced both over the course of my life. I was in diapers for the first 19 years of my life, and it wasn't exactly fun. When I was 19, I ended up going to the hospital for a bed sore, bone deep, and it was infected to the point where it had to be emptied from within the tissue of my body, and had to close it up. And as a result of that, I now wear a colostomy bag. Maybe I can find one here. No. Well, anyway, I wear a colostomy bag, and basically what it is it's a bag that you defecate into rather than, the normal way out the rear end. There's two parts to it. There's a bag with a clip on the end, and then there's a appliance that you stick to your stomach. What the doctors do is they reroute the feces through a hole in your intestine, out your stomach into this bag, and it's a lot easier that way, so I don't end up getting more bed sores. Because what was happening was, the moisture from the diapers was just causing problems for me, and it just got so much worse that, something needed to be done about it. And speaking of moisture, bladder problems. Now, for my bladder, I have incontinence. I can't hold urine in like most people can. Like, say, if I laugh too hard, I will most likely wet myself. So, with that said, I use what's called a catheter, as you can see right here. It's pretty self-explanatory. The funnel right here is where it comes out, and this is what you put in. I've been using catheters for a while, and something interesting happened. When I say interesting, I mean painful. When I went to the hospital for the bed sore I mentioned earlier, it came time to change my catheter because I was using one of those oversized ones that could be kept in for a month at a time. And needless to say, I ended up having a massive pain in my bladder because the nurse put it in too fast and it cut my bladder and it ended up filling with blood clots. Now, I know it's not the same thing, but I called it my man period because holy hell, it hurt. And I hope it never happens again. Abnormal eye movement. Well, I have a lazy eye. I don't know if you can see this. I have a lazy eye. Like, if I don't look straight ahead or focus on it, my eyes just go every which way. And actually, going back to bladder control, something I have problems with is I have bad kidneys. Like, one of them is actually really small compared to the other, and as a result, I need to drink a lot of water because I am very susceptible to urinary tract infections. And those aren't very fun either. They hurt. They cause cloudy urine and whatnot. And it's just a headache for everyone involved. If I ever get one of those, I go on medication, or I have to start chugging water like my life depended on it because, well, kind of does actually, because I don't want my kidneys to end up failing on me. Even though I will admit I do love soda. Pepsi is my favorite. And as I said before, pressure sores. I've had a few of those. In fact, as I said earlier, I had one in a rather, shall we say, not ideal area. I won't go into the specifics of it, but it was in a part of my body that I cannot feel, which is I cannot feel anything from my knees down, and I cannot feel my buttocks. Also, in terms of sexual things, I have no idea if I can in fact have intercourse. I have trouble holding erection. I am unable to ejaculate. I read somewhere that, and rather than it coming out when I do that, it goes backwards back into the bladder, and I found that kind of interesting. And funny story, I was hanging out with my ex one day, and I guess I was talking to my girlfriend at the time about maybe having kids someday, and my mom told her straight up that I couldn't because I'm not capable. I guess I don't have a whole lot of sperm, if any, inside me because of my disability. So I'd have to ask my doctor about that, but if it turns out that I can't, then adoption is my only option. But, that's not so bad. Also, I have an allergy to latex. Latex glove and everything like that. And I have a club foot and scoliosis. My one foot, you probably can't see it so I'm not going to show it. Okay, here's a regular foot, right? Well, the other one sort of bends off like that a little bit, and it basically made it kind of difficult for me to walk. And speaking of walking, I used to be able to walk when I was a kid, but for whatever reason, it got to the point where I couldn't get my legs to straighten out far enough to lock my leg braces in order for me to stand up. Like, I'll try and show you this here. Like, here, hold on. Like, a regular person's leg, or an able-bodied person, I should say, their leg can go straight out like that. My leg, both of them, can only go at about 100 and it can only go about a quarter of the way out. And as a result of that, I haven't been able to walk since I was I want to say 12 years old now. And also I have scoliosis. I'm sure some of you know what that is, curvature of the spine. I have trouble sitting up straight, and it's affected my posture a little bit. And, I have to lay down every so often to relieve the pressure so I don't end up getting pressure sores. And when I lay down, after a while, oh boy, does my back hurt. Well, not really hurt, but it gets tight. And sometimes it's painful, but sometimes it feels really good to relieve the tension from my back like that. Also, I have what's called hydrocephalus. And basically what hydrocephalus is, it's water on the brain. I have excess spinal fluid forming in my head. And to alleviate this, they put a little pouch here. It takes the fluid from my head, goes down through my head, down through my neck. I don't know if you can see this here. That is the cord to my shunt, and it goes all the way down, and it wraps up into my stomach, and it deposits the excess spinal fluid that way. Without a shunt, I would have mental deficiencies. I don't know how else to put it. I've had a few revisions, but I I haven't had any in a long time since I was a little kid. And thank the good Lord it hasn't malfunctioned yet. Yet. I'm not saying it will, which I hope it doesn't, but knowing me, it probably will at some point. In terms of my social life, as I was growing up, not everyone knew what to make of me because, well, being a 3, 4, 5-year-old kid in a wheelchair, and meanwhile everyone else is walking around freely, it looked at me like I was a robot or something. And it made me kind of self-conscious there for a while. But as I grew up, people started getting used to it and knowing more about my situation. And it got to a point where, I started making friends. Some of them felt sorry for me, sure. But some of them genuinely wanted friendship, and that was something I struggled with when I was little. And as I got older, I started getting picked on because I was the only disabled kid in my entire school for a long time. The people would say, "Oh, you would never have a girlfriend because they don't see you as a normal human being," or, "Oh, you'll never be able to walk or do anything that you want." But I don't listen to that anymore because number one, I graduated from high school, barely, but I still graduated regardless. I do what I love to do daily for hours on end. And I have had plenty of relationships. Well, only 2 of them in person. But regardless, I've lived a pretty normal life except for the the medical side of things, and I'm just lucky to be alive. And I'm happy that I'm alive. And I wouldn't have it any other way. So, with that said, this has been a video seminar brought to you by Turbo Wheeler on Spina Bifida and how it has affected my life. If you enjoyed what you saw here, please consider leaving a like, commenting on what you thought of it, and subscribe to my channel if you feel so inclined to do so. So, in closing, I say thank you for watching, and remember, everyone should be treated equal, able-bodied or not. And as Eminem once said, you can do anything if you set your mind to it. Keep on rocking.